Yeah, I think this whole issue of what we call U equals U, which means undetectable equals untransmittable, which means that if an HIV positive person takes his or her medications, HIV medications, and the viral load is undetectable, and we defined undetectable as less than 200 copies per ml of virus, that you will not transmit the virus to the negative, HIV negative person. Um, that information is taken from sexual encounters. We don't know what if that applies to exposure from blood. So an IV drug user, does that apply there? It's not clear at this point, but definitely from a sexual standpoint, um, if your viral load is negative or undetectable on medications, you're not going to give it to the negative person. And I think that's really huge. And what's interesting about that um, uh, uh, data is that the CDC was the last kind of organization to accept that. The whole world had accepted that was true based on good studies. But of course, the United States, being more cautious, uh, waited for a while to accept that data. And I think that's a huge difference because, sex to me is something that you want to try to practice as naturally as possible. And I think this gives a little bit more freedom in terms of the kind of sexual practice. Although, you still should use condoms because condoms protect against other STDs. So you really should still be using condoms.